New videos every day.
Okay.
Hi, this is Dr. Echols again, and today we're going to talk about a specific adjustment called the lumbar roll, or some people call it just side posture. Now this is anybody who's ever gone to the chiropractor is pretty familiar with this adjustment. It can be a real lifesaver. Sometimes people come in and they're barely able to walk, and when they come out of the chiropractic office, they usually are walking a lot better or feeling significantly better. And one of the things that can happen is that the hip bones, the iliums on both sides of the sacrum, and I'll show you what these words mean in a second when I'm looking at my spine, but those can sometimes get out of alignment. And that can happen just through slips or falls or poor posture or just the stresses of daily living. And when that happens, we call that the sacroiliac joint. It can sometimes rock back or it can rock forward. Sometimes it can rock in or rock out. And this causes the relationship of the joints to be aberrant. It doesn't work properly. And that can set up a whole lot of pain right over this area of the back right here. Now, oftentimes, when a person is having that, it can also produce sciatic pain. Sciatic nerve is the largest nerve in your body. It's about as big around as your thumb. And it's a coalescence of nerves that comes directly off of the lumbar spine or the lower back, and they come together and they go right down through that portion of the rear end and all the way down into the leg, and they even go all the way to the feet. So oftentimes patients will come to me and they'll complain about pain that's in the back of the leg, the side of the leg, sometimes even in the front of the leg. Sometimes that pain will stop right in the rear end, other times it goes all the way to the foot, and this is what we mean when we say sciatica. And this adjustment that I'm about to show you can be very, very helpful for that. So here's the spine. We're looking at it from the back side, like I'm holding them up. Now, these are the ilium. This is the sacrum. This is your tailbone or your coccyx right here. Now, what can happen, not only can the vertebrae themselves misalign and cause problems like we've talked about in other videos, but these joints here, where this bone, this big bone, hooks onto this bone, that's called the sacroiliac joint. And that can sometimes get out of alignment, and it can just not rotate and move. When we walk, these ilium rock back and forth on that joint there. And sometimes through slips or falls or sports injuries, or like I said, it's just living, it can start to cause these bones, to either rock forward, rock backward, rock in, or rock out. When that happens, this hole right here is where your hip joint hooks in. And when I keep saying vertebra, but it's your hip, your ilium here, when it rocks, it can actually pull that hip up and pull that femur up, and it'll actually make the leg appear shorter on one side than it is on the other side. I always joke around with my patients. I say, man, if you got lost in the woods, you'd walk in a circle, because one foot's a lot shorter than the other one. So when that happens, it can also set up more disrelationship in the spine and cause problems in here. So keeping this pelvis nice and level is very important. Now, speaking of being level and having this pelvis nice and level, this is especially important for ladies that are pregnant. You can see that hole right there, kind of looks like a heart what you're looking at it here, but this hole right here, that's where the baby comes through. And if this is misaligned there, it can close down that hole and cause problems for the baby to get out. So we adjust ladies all the way through their pregnancy to keep that hole as wide and open as we possibly can. And when that happens, that baby comes out much, much easier. The labor is a lot easier on the woman and on the baby for having a nice open birth canal there. Now, once the lady has the baby, there's certain hormones in the body that make these a lot more flexible. Once that happens, sometimes these bones can oftentimes get out of place, and the woman can start to develop back pain or hip pain after delivery. And that's a real good time to get those realigned and readjusted like this. So we're going to get Miss Karina back on the table today, and I'm going to actually demonstrate how to find out whether this pelvis is in the proper alignment, and then we'll show you what an adjustment looks like on that. Okay, so we've got Miss Karina back on the table. And what we're going to be doing is examining the whole pelvis as she's laying here. Now, one of the things that we can see with her laying here is just that this glute is a little bit higher than the other one. It's hard to see with the camera angle being the way it is. But when I put my thumbs here, I can see that this hip bone has rocked backwards. And when that happens, it pulls this hip up, this leg bone up. And if I go down here to check her leg length, I can see that this leg here is going to be, you know, 1/4 to an inch, a little bit shorter than the other one. And that can cause problems. And oftentimes if you look at somebody's shoes, you can see that there's abnormal wear on that. And not only can that be caused by the leg being shorter, but by the foot being pronated or supinated improperly. So Karina told me earlier that when she gets pain, I think it was right here, is that correct? Mm-hmm. Yes. So this is where the sacroiliac joint is that I showed you earlier. It's where this hip bone hooks onto the sacrum. That's why they call it the sacroiliac joint. And this joint is supposed to move. And oftentimes, if that joint locks up and it stops moving, it'll get inflamed in through here. And it may not even hurt until you touch it. It may not. But these are the kind of things that can cause pain to radiate in the back or cause leg pain. So we've already evaluated exactly what the problem is. Now we're going to go ahead and adjust it. It's important to note that if this hip rocks back, oftentimes this one rocks forward. So I normally will adjust both sides. All right, so now that we've discovered what the problem is, we're going to go ahead and start adjusting this to correct it. And Miss Karina, what I'd like for you to do is just roll onto this side for me. And we're going to adjust this headpiece so that your neck is comfortable. And we're going to have her bend the top leg up, but keep the bottom leg straight. There we go. Oftentimes a person's going to feel like they might kind of slip, but I'm kind of a big guy and I don't let anybody get by me here. And we're going to just pull this arm up through here and give yourself a big hug, just like that right there. Now, since this hip is rocked backwards, this one oftentimes rocks forward. So we're going to put just a little pressure right here. And sometimes the person will hear a little clicking in here, just like we talked about in an earlier video. So just take a deep breath for me and relax. A little bit of a push in through here. There we go. Perfect. Good job. Now, I want you to roll over on your other side for me. Good. Okay, so we've adjusted one side of her pelvis. Now she's rolled over on the other side. This is the side that she was actually hurting on. This was right there in that lower portion of the back, and this is where she was talking about. So I'm going to lean her over a little bit. Breathe. There it goes already. Perfect. Good. And you could feel that moving there really good, couldn't you, Karina? So just a very light amount of pressure in that area, released that joint, and started it back into its normal physiological range of motion. I expect that she'll get tremendous relief from this. I hope this has been helpful for you. If you have any more questions, please feel free to go to my website, jeffechols.com, or email me or call me. Hope this was helpful. Bye-bye.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.